Every heartbeat is a miracle. Behind every pulse, a force of blood pressure quietly sustains us. It's a silent rhythm within, often unnoticed, yet critical to our well-being. Blood pressure is the measure of force your blood exerts on the walls of your arteries. It's expressed with two values, systolic when the heart beats, and diastolic when it rests. Together, they form a snapshot of cardiovascular health. Too high, and your heart works overtime. Too low, and vital organs may be starved of oxygen. Understanding this balance is key to a longer, healthier life. Your heart has 4 chambers, 2 atria, 2 ventricles, working in rhythm to send oxygen-rich blood to the body and return carbon dioxide to the lungs. Each contraction sends a pressure wave through the arteries. This is your systolic pressure. When the heart relaxes, it's diastolic. Together, these numbers help us understand how hard your heart is working and how well your vessels are handling it. This is an electrical representation of the heart rhythm, which can be seen in an electrocardiogram. In a world moving faster than ever, stress, diet, and lifestyle silently influence our blood pressure. Regular monitoring, especially at home, is no longer optional. It's preventive medicine in action. Digital monitors make this simple. In less than a minute, you can learn if you're on track or need to take action. Wellness isn't a solo journey. Sharing your health routine, even something as simple as checking blood pressure during a gathering, can spark life-saving conversations. In community, we find accountability. In support, we find healing. Blood pressure awareness can begin with just one conversation. Yes, we all love the indulgences of pizza nights with friends, fizzy drinks, and parties that stretch into the night. The key isn't deprivation, but moderation. A balanced lifestyle allows room for joy when paired with healthy habits like regular checkups, low-sodium meals, hydration, and mindful movement. High blood pressure is called the silent killer for a reason. Often, there are no symptoms until a heart attack or stroke strikes. Still, some signs may appear: fatigue, blurred vision, chest pain, or headaches. These signals should never be ignored. If in doubt, check. If unsure, speak to a doctor. Control is within reach. Eat fresh, natural foods, fruits, vegetables, whole grains. Limit processed and salty snacks. Move daily, even short walks help. Sleep well, reduce screen time. Practice calm, meditation, music, nature. These small habits combine to shape a heart-healthy life. Your heart can't speak, but blood pressure does. Stress, lack of sleep, poor diet, smoking all raise pressure and strain the heart. Left unchecked, this silent overload leads to damage, strokes, kidney failure, heart attacks. But awareness means action, and action means prevention. Inside every person beats the same rhythm, a pulse that reminds us we are human, alive, and connected. So check your pressure. Listen to your heart. Because the strongest muscle in your body is also the one that loves you the most. Blood pressure connects us all. It is the invisible force flowing in every human body, regardless of age or background. By checking it regularly, managing it wisely, and sharing what we learn, we turn this silent number into a symbol of care, action, and life itself. Check. Share. Care.